Okay, it's 7:30, so I will get going. More people will trickle in as I speak, but I've always one to like to be punctual. So thank you for joining me for tonight's masterclass, which is all about fever, phobia. So just watch how many times I trip over saying fever, phobia tonight. It's a great one. It's a great tongue twister. So I have done a lot of research on fevers in the last month. So this is a culmination of all that research. And on every page, pretty much, I have a little link to some research or a PubMed identification number or something where you can go back and validate what I've said. And the great thing is about this topic is that, often in life, what a naturopath says might be quite different to what the conventional medicine system says. And then you're left with a decision of, do you want to go with the naturopathic way? Do you want to go with the conventional medicine way? Do you want to go somewhere in the middle? But interestingly, on this topic of fevers and fever management, the conventional medical advice is actually the same as my advice. So that's very reassuring. And as I say, if you're in any doubt about anything that I say, just take down the PubMed ID number or have a look at the reference, or I can send you a list of references at the end and you can head off and double check. So without further ado, fever phobia. So I would love to say that I made up this term, but unfortunately I didn't. So this term was actually coined in 1980 by a doctor called Dr. Schmidt, and it was to describe parents' unrealistic concerns about childhood fever. So fever phobia is not a new concept. It's been known that people are misunderstanding fevers for a long time. So this is just to say, if you do want medical advice on anything, probably don't go to Facebook, because this was a post in a parent's Facebook group just a few days ago about a mother post that said her child was at 40.8. So the advice was take him to the hospital right now, hospital now. And that was actually not true. So that there is actually no need to go to the hospital with a child who has a 40.8 degree temperature with that solo bit of information. Absolutely. There could have been other reasons with that child that they do need to go to hospital, but that's not what the mother was asking. The mother was just saying, child's temperature is 40.8. What do I need to do? And pretty much unanimously, it was hospital right now. So I just want to introduce my team at the Pediatric Naturopath, because there's actually 7 of us that work with kids and kids' health. So we all have different specialties. So I'll just run through us all quickly so you know who's who. So first cab off the rank is Summer. So Summer is a nutritionist and a feeding therapist, great with eczema, constipation, fussy eating. This is me. I'm a nutritionist, a naturopath, and a feeding therapist. So love some complex cases and extreme fussy eaters. Kelly is also a nutritionist and a naturopath. She also loves complex cases, and she's a bit of a niche specialty in the vaginal microbiome, which people say, well, what's that got to do with kids? But so many little girls have issues in that regard. So Kelly is an absolute whiz at that, along with lots of other things. Kate is also an EMDR practitioner, so she'll help the anxious kids. Sarah is a nutritionist and a feeding therapist, so again, fussy eating. Amy's an absolute legend at interpreting hair tissue mineral analysis, so all sort of neurobehavioral sort of issues is our Amy. And then Sonia's specialty is epilepsy. So if your child has seizures, epilepsy, Sonia is your person. Whoops, oh my God, I just skipped to page 38 somehow. Whew. So this is what we're going to go through tonight. So we're going to talk about the facts about fever, because that really sets the scene about when we need to worry and what actually a fever is. We are going to talk about red flags because there are some situations where you will need to go to hospital with your child. We're going to define a fever. We're going to talk about medication and medication overuse, and then we're going to spend a good bit of time on febrile seizures, what they are, how to avoid them. First of all, we're just going to run through the questions that actually pretty much all of you answered. So thank you very much for doing that little bit of homework in advance. So these are the questions that you would have answered. So what's the normal temperature? What's a fever? What's a high fever? Do you think fever is harmful? And if so, at what level? What is your main concern when it comes to fevers, and how do you actually check your temperatures? So we'll be checking in with these questions as we go along to see what the actual correct answer was. And to be honest, I was actually really impressed that most of you, would have answered correctly in this. So that was good. So the first thing is, what is a normal temperature for a child? And the normal temperature is about 37, so kind of 36 to 37. So you can see about 90% of you got that right, which is awesome. So yes, good. Obviously, you could have Googled it, but I'll trust that you didn't. So a fever, why? What is a fever? What's it all about? So fever is not an illness. It's actually a mechanism that your body has to do the job of helping to fight infection. So fever is not bad. Fever is what is helping your body to get over the illness. And it does that in a few different ways. It will slow down the growth and reproduction of bacteria and viruses. It enhances neutrophil production, so some of your white blood cells, improves your T lymphocyte proliferation, which is another part of your immune system, and it helps your body actually have that acute phase reaction. And the link you can see at the bottom of the page, that's the link if you want to read more about this. So if it's over about 38 on a thermometer, and that will vary depending on where you take the reading, and I'll discuss that later, but that's what's considered a temperature. So your child might also feel hot, might be unwell, sleepy, vomiting, shivering, and they might actually be in pain. So this is just in big letters, this is my disclaimer. So some kids with a fever will be sick, and they might be very, very sick, and they might need treatment. So I'm not saying that, you just ignore this. I'm saying I'm trying to educate you on the fever aspect of it. And if you're worried about your child, please go to see a doctor. I'll talk more about the red flags in a minute. So this is just the fever facts. So the degree of the fever does not always correlate with the severity of the illness. So looking back at that mother on Facebook, where at 40.8, everybody said go to hospital. 40.8 doesn't mean that that child is necessarily sicker than if it was 39. Most fevers will not last very long, and they're benign, which means they're harmless, and they actually protect the host because they have that impact on their immune system and reducing the replication of bacteria and viruses. They have beneficial effects on your immune system, and the fever actually helps the body recover more quickly from viral infections. So think back to a time where your child had a fever and you gave them Nurofen and Panadol, and the fever went on for 5 days, and you were giving them Nurofen and Panadol for 5 days. Maybe if you hadn't have given them Nurofen and Panadol on day 1, they would have been better by day 2. Maybe. That's kind of what the evidence points to. There's no evidence that children with a fever are at increased risk of adverse outcomes such as brain damage. So hyperthermia is something different. Hyperthermia is like if you get sunstroke or if you get left in a hot car. That's hyperthermia. But a fever is different. So a fever will naturally top out at about 41. It won't get higher than 41 point something. So it won't just keep going and going and going unless you give Nurofen or Panadol, but it will if you leave your child in the car. And it's never been shown in humans that increases in core temperatures encountered in a fever, which never exceeds 41, are harmful per se. So there's no evidence that a 41 degree temperature is harmful. But also, the fever may result in discomfort in children. So if your child is absolutely miserable, crying, in an absolute state, you can certainly treat the fever. If it's 39 or if it's 41, doesn't really matter. If they are absolutely beside themselves and they've got a temperature, it's okay to give them medication. I'm not saying don't ever give them medication, but I'm just saying it's not about the number, it's about the child in front of you. And there are benefits sometimes of reducing a fever. So patient comfort and then stopping them getting dehydrated. So nothing in life is black and white. And people will often say to me when I post something on Instagram, people say, but it's not black and white. It's like, I know, exactly. It's not black and white, but you have to see both sides of the story and you have to understand the full picture. So these are the red flags. So if you've got a little teeny tiny one, so a baby less than 3 months with a temperature over 38, you need to go and see, you need to get medical advice because that can be a range of things that need medical opinion. And certainly you do not want to just give them Nurofen or Panadol. If they're that age, they need to go and find out why they have a temperature. If a child has a weak immune system because they're on chemo or something else, then you also need to consult a doctor. If they've got a temperature over 38 plus, that's the key thing, plus they've got a stiff neck, they don't like the light, they're vomiting, refusing to drink, more sleepy, problems with breathing, pain that doesn't go away, then you need to see a doctor. And that's from like the clinical guidelines, and it's at 38. So that's not once you hit 40 and you're more sleepy, you need to see a doctor. That's at having any sort of a temperature plus all these symptoms, see a doctor. And if they've had a febrile convulsion, even though febrile convulsion isn't necessarily, well, it isn't harmful, and you still want to consult with the doctor after that happens. So what temperature would you consider a fever for your child? And 96 people answered that. So yes, thank you. And you can see most people said 38, 38.5. So again, pretty good. But you can see that there were 4 people that would, think their child has a fever when their temperature is 36 or 37. And reading through the literature, there is an alarming amount of people that will actually medicate a fever at 37, even though that is perfectly normal. And if your child's a bad sleeper or, a high-spirited child, you can see why people would do that, but it's definitely not the right thing to do. I should say as well, ask questions as we go along. If I could see, yes, I can see the chat box. So if I'm going along and you have a question, just pop it in the chat or unmute yourself and ask me. And if I'm going to cover it later on, I'll just tell you I'm going to cover it later on. So people will often say to me, oh, my child had a high fever for like a week and blah, blah, blah. And when I say, well, what actual temperature was it? And they'll say, oh, it's 38. It's like, yeah, no. High fever is 39 to 41. So if your child has anything below 39, it's not a high fever. And so according to my poll, 25, 30, 37 of people thought it was high below that. So there's definitely people in this audience who would be overly concerned about a fever being high when it's not. So this is a great little reference of the different places you can take a temperature and then what normal is and what a fever is. So the rectum, so in your bum, that is the gold standard for measurement accuracy. And back when I was a child in the 1970s, definitely people were taking the temperatures up their children's bum. But as it says here, not child friendly. And the fact that I know a lot of people who remember getting their temperature taken up their bum probably says that it was a little bit maybe not the best thing to do. But you can see if you're taking the temperature in the bottom, fever is over 38. if you're taking it in the armpit, it's over 37.4. So there is variation depending on where you're actually taking the temperature from. I think armpit is a really good way to do it because it's safe, it's easy available, and it's convenient. So, and for little tiny babies, it is as accurate as in the rectum. So medication overuse is a massive problem. And there's a few reasons why people can get into difficulty with medication for fevers. They can dose wrong. So those little syringes with Nurofen and Panadol are very easy to misinterpret. And if you misinterpret it once, doesn't really matter. But if you're dosing your child every couple of hours with either Nurofen or Panadol and you're getting a dosing error every time, that will add up and that can be dangerous. And I think I read a statistic that 51% of children have been given the wrong dose at some point in time. If you're using like cold and flu medications, as well as something for the temperature, you could be overdosing paracetamol because it's in a few different things that you're giving and you're not aware of it. And there's also an issue where sometimes adult medicine is used, I guess, because, you know, when do kids get sick? 12 o'clock at night and chemists are closed. So, you know, sometimes I guess people will have the adult medication in the house and not the kids' medication, but that is, you know, really fraught with danger and it's going to be very easy to give the wrong dose. Now, I do throw in things to kind of make you sit up. And you can take it or leave it, the seriousness of it. But paracetamol increases the death rate from flu in animal models. So it's not in adults, but when there's smoke, there's fire. So in animal models, treatment with antipyretic, so paracetamol for the flu increases the risk of mortality. There are no randomized placebo-controlled trials of antipyretics, so anti-fever medication for flu in humans that reported data on mortality. So there isn't the evidence to say that this is or isn't a problem for adults. So the bottom line, we suggest that they need to do trials of anti-fever medication in the flu in humans. Pretty sure that hasn't happened. And whilst fever phobia is not a new thing, the use of medication to deal with fevers has increased significantly. I always struggle to move my little thing out of the way. So in 1980, 67% of parents would use drugs for fever. So about two-thirds. And in 2002, it's at 95%. I assume it's similar because there's always going to be about 5% of people who won't do that. And yes, 50% of febrile children had it at the wrong doses. So it's skyrocketed. It's become a lot more normal. And even though I said at the start that the medical community is completely aligned with the fact that you don't treat a fever, you treat the child and their symptoms, not just the numbers. If you actually look at Panadol ads, that's not what the Panadol ads are saying. The Panadol ads are saying something completely different. And if your child has a fever, do you Google the Royal Children's Hospital clinical guidelines or parent information sheet? Or, you know, does Panadol come up when you start searching? So I think a lot of the problem is that we're getting our information directly from the drug companies, not from the clinical guidelines. More kind of reasons why you should consider your paracetamol usage. So viral infections, dehydration, and underlying metabolic disease can make your liver a bit wonky, which makes paracetamol more toxic. So acetaminophen is the American word for paracetamol. So of course, if your child has a fever, they probably have a viral infection. So being sick makes you more at risk of the toxic effect. Fasting or inadequate protein intake can worsen the degree of toxicity because it depletes glutathione. So glutathione is your master antioxidant in your body, does a lot of good things. And if your child is sick and they haven't eaten for a few days, and when they have eaten, it's certainly not been a steak, then they're again going to be more susceptible to harm from paracetamol. And children taking these drugs, so the first two are anti-epileptic medications, and the second two are anti-tuberculosis medications, funnily enough. So I imagine none of you have children on anti-tuberculosis medications, but I imagine some of you might have children on anti-epileptic medication. That also puts you at more risk of paracetamol toxicity, and you should be advised to reduce the dose. It's also, paracetamol has not been proven as safe from a neurodevelopmental point of view. So you can see at the bottom, paracetamol is widely thought by pediatricians and parents to be safe when used as directed. And it's the most widely used drug in kids, with more than 90% of children having taken it at some point in time. It's known to cause liver damage in adults or when used in excess. But what is new is that nobody has actually checked to see if it's safe from a neurodevelopmental point of view. So it might be, but nobody has checked. So just to say it's safe when it hasn't been tested for the long-term neurodevelopmental impact, you can't really say something's safe. So this is a big one that I bet you've been told, or you've heard, or you've even done, about alternating the Nurofen and Panadol every 2 hours. So this is not actually good to do, and it's not actually evidence-based at all. So the American Academy of Pediatrics, so again, not a naturopathic organization, this is the doctors in the US, the pediatricians. Conclusion: acetaminophen, so paracetamol, and ibuprofen, so Nurofen, are commonly being used in an alternating manner for management of fever. There is no scientific evidence that this combination is safe or achieves faster fever reduction than either agent alone. There is evidence that improper use of these agents may cause harm. 30% of people actually say that this recommendation comes from the American Academy of Pediatrics, but it doesn't. So they don't actually approve of this, condone it, recommend it. And so American Academy of Pediatrics, pretty solid. And then the British Medical Journal, also pretty solid, not known for their naturopathic sympathies. And they say only marginal benefit was shown for the combined treatments compared with each drug individually, which, when you take this alongside the risk of overdose and the fact that telling somebody to alternate Nurofen and Panadol actually increases the fear of fever, and we know fever is not harmful, there is little to recommend it. So if you've been told to do this, I would stop. And you might even want to go back to the person who told you this and kind of get them to go back to the evidence on it. And again, this is Australian Prescriber Journal, not naturopaths. Paracetamol has a mild beneficial effect on the symptoms of viral illness. However, the child may still remain unwell. Data suggests that fever may have an immunological benefit, and paracetamol may not decrease the number of recurrent febrile convulsions. There are good reasons, particularly related to toxicity, for limiting the use of paracetamol in children. So that's 3 different mainstream big organizations that are saying, watch out, there's trouble ahead. If you watch all this and say, yeah, nah, I'm still going to get paracetamol, just read the instructions very, very carefully. And I'm not going to read through this, but stick to the safe guidelines and be very, very cognizant of when you're measuring it, that you're giving the correct dose, and treat the child, not the thermometer. So this was an interesting study though. And if you use a rectal suppository, it actually will bring down the fever better than doing anything. And so again, if you're absolutely dead set on using paracetamol for a fever, get the suppositories. They work amazingly quickly. When my kids were little tiny babies, they vomited with Panadol, so it was never an option to give it to them. And even when I told daycare, I ticked on the box, do not give my child Panadol, and they still did, and they spewed it up. So yeah, I told you not to. So there were occasions when I had to do a rectal suppository, which you can only do, well, I only felt comfortable doing it when they were quite little. I can't remember what age that became weird, but it works amazingly quickly and it will be more beneficial. But why you shouldn't treat it is because you can delay the identification of an underlying diagnosis. So if your child has actually something seriously wrong with them, like sepsis or meningitis, and you're just giving them Nurofen Panadol to chase the numbers down, you could be missing something very, very critical. So it's a symptom, it's a sign that you need to be aware of. Talked about drug toxicity at length, and we've talked about the effect on the immune system. So another little result from the poll. So 36, so over a third of people thought fever was harmful, and people thought sort of it started to get harmful at about 39.5. But as we've discussed, fever isn't harmful. Fever on its own, like the actual fever, no matter if it's 41, 40, that is not harmful. The condition that it's with might be. Febrile convulsions. So I'm going to talk quite a lot about that because, as you can see, if you think fever is harmful to your child, why is that? Half the people, it was because of febrile convulsions. And this, when I've been digging through the research, this is definitely rings true that this is what people are worried about. And Facebook groups are really exacerbating this. So what is it? What is a febrile convulsion? Febrile seizure, same thing. So it's a seizure which happens in a child between the age of 6 months and 5 years, which is accompanied by a fever, 38 degrees or greater, without central nervous system involvement. They can be simple or they can be complex. The complex ones will go for more than 50 minutes, and they are, definitely need more workup than a simple one. They occur in about 1 in 30 children, and children with a simple febrile seizure do not have a greater risk of having a UTI, pneumonia, bacteremia, or bacterial meningitis. So having a seizure, a febrile seizure, doesn't mean that there's something worse wrong with them than if they hadn't have had a seizure. And so this is from the Royal Children's Hospital fact sheet on febrile convulsions. So again, if you don't believe me, please believe the Royal Children's Hospital. A fever is the body's natural response to infection. It's not necessary to reduce it. Treating a child's fever with paracetamol or ibuprofen will not prevent a febrile seizure. So this is well researched, well documented. If your worry about fevers is them having a seizure, which for half of you, that is your worry, giving Panadol or Nurofen won't stop the seizure. But same as what I say, if your child's miserable, yes, you can treat them. If they're more than 5 minutes, call an ambulance. If it's less than 5 minutes, but they're really sick, still go to hospital. If they're less than 5 minutes, but they're kind of okay, just make an appointment to see your GP for follow-up. Don't panic. They're terrifying. My kids have never had a febrile seizure, but one of my children used to have reflex anoxic seizures where they just kind of passed out and they went grey and stopped breathing for like a minute, and they were absolutely terrifying. So without a doubt, watching your child have a seizure is terrifying, but you have to remember, if it's less than 5 minutes, it is nothing to worry about. And in fact, most children with a febrile seizure, their temperature will actually be less than 39. So the kids at 41 or 40 are no more likely to have a febrile seizure than the kids at 39. And it's a lot to do with the rate of increase of the fever, not the actual temperature, but kind of how quick it escalates. But there's also a school of thought that it's actually nothing to do with the temperature. The temperature is an incidental finding. So the infection that's causing the fever could be triggering the seizure, not the temperature. So that's something that's, being discussed and explains why it's not like the 41 degree temperatures that are a problem. So it's an interesting thought as well. So that's all well and good, but you're still worried about febrile seizures. So I'm all about empowering parents to actually do something about their worries. And these are all the evidence-based things that you can do. So check on zinc, check on iron, give fish oil, breastfeed if it's that's still an opportunity to you. Look at calcium, look at magnesium, look at vitamin D. And then we're going to talk a lot more about these. So first one is calcium. So this is just a case report. So just talking about a child who had low calcium, had seizures, and then got calcium and vitamin D, stopped having febrile seizures. Kind of weak evidence, but I think there was more evidence. I just chose this one to put in. And the same with magnesium. So serum magnesium, so magnesium in your blood, was significantly low in febrile children with seizures compared to those without. So hypomagnesemia is associated with the occurrence of febrile seizures. So again, if you're worried about febrile seizures, if they've had febrile seizures, if siblings have had febrile seizures, think about magnesium. Same with zinc. So zinc levels on blood tests were significantly lower in children with febrile seizures. Zinc deficiency will affect the communication in your brain, causing seizures. And in my practice, I see a lot of fussy eaters because that's one of my specialties, and they will all be low in zinc because zinc is found in meat and it's found in vegetables, nuts and seeds and everything, but it comes along with phytates. So even if, you got a spreadsheet and you worked out the amount of zinc your meat refusing child was eating every day, it might be yeah, that's good, but it's not getting absorbed because all the other anti-nutrients there are stopping it. So without meat, and by meat I mean fish, like animal products, you're going to be low in zinc. Iron, again, I see a lot of kids with low iron, although this is something that doctors will screen for a lot more than zinc. Basically, doctors will never screen for zinc. But having low serum ferritin is also associated with febrile seizures, and that's probably to do with, again, the GABA is a calming neurotransmitter in your brain, and when you're low in iron, you're going to have less GABA, so that's probably related to that. Fish oil, so DHA, omega-3, it decrease further febrile seizures in mice. It's giving a supplement after a febrile seizure will reduce the likelihood to have another one. And for pregnant mums, taking fish oil when you're pregnant will reduce the chance of your child having a febrile seizure. Breastfeeding is obviously great. It's the association with breastfeeding febrile seizures is really strongest for preemies. So if you have a preemie, breastfeeding is definitely going to reduce the risk of febrile seizures. For non-preemies, it had to be exclusive breastfeeding to see a benefit. So if you're mixed feeding, then you might not see the benefit. But obviously, it reduces the risk factors for seizures, such as getting sick. It helps your immune system with your baby. So, breastfeeding is good for everything. And vitamin D. So having a vitamin D deficiency is associated significantly with simple febrile seizures, and their occurrence is negatively correlated with it. And my dream vitamin D levels for people is a lot higher than the conventional medical system. So if they're seeing it, then yeah, that's really critical. So you're thinking, oh, well, that's really interesting, Lisa. What do I do with all that information? So the easiest way to check most of these things is to do a hair tissue mineral analysis. So it is exactly what it says in the tin. It's a hair sample, so you don't need to do a blood test to do this test. You take a sample of hair, costs $210, so it's not super expensive. You send it off and you get this report back, which looks at nutrients on one side and toxins on the other. So this was a 4-year-old boy who came to see us. Well, his mother brought him to see us. He didn't just decide. And the reason was he kept having febrile seizures and the mother was concerned. So you can see the elements, the nutrients that we've spoken about: calcium, magnesium, zinc, and iron. Think back to your high school periodic table. You can see this guy was significantly low on all of these things. The optimal line is about where this red line is down the middle of the screen. So he was way below it for the nutrients that are associated with febrile seizures. we can't check like essential fatty acids levels in your blood on a hair test. We can't check vitamin D on a hair test. So this doesn't help with that. But already we can see this child needed calcium, magnesium, zinc, and iron. And we give him those and he didn't have any more seizures. If your child has had a febrile seizure, giving vitamin C is one of the best things you can do to help them because it reduces the impact of the oxidative stress on their brain. So yes, you can give lots of oranges. This is me holding an orange from my orange tree. But realistically, to get the doses that you want to get for the therapeutic benefit in this situation, you would want to be giving a vitamin C supplement, which generally tastes really good. I love the vitamin C I take in, like, it's just an orange flavored powder and water. I think it's delicious. Other risk factors for febrile seizures. So some of these are going to be within your control. Some are not. So smoking, don't smoke. Babies who are in NICU for more than 28 days, which means they're kind of babies who got off to a slower start in life, they're going to be more susceptible. Kids with a developmental delay, if they've had a first or a second degree relative with a febrile seizure, if they go to daycare, it's part just because they get sick more, if they're under 18 months. And this is critical. So the fever is less than 1 hour. So again, it's about that rate of change of temperature, not the kind of temperature that gets to. So child comes home from daycare at 5 o'clock and he's fine. And then by 6 o'clock, he's a mess and he's got a temperature. That's more the situation where you might see a febrile seizure. So you do not need to treat a fever. So I'll say that again. The fever doesn't need to be treated for fever's sake. But if your child is miserable, crying, like, they're miserable because of the fever, then sure, you can do these things to treat it. But even with natural remedies or with pharmaceutical remedies, you don't need to treat the fever just to chase the numbers. But we can use herbs, homeopathy, and flower remedies. So these are some herbs. So oral means you take it in a mouth, like in a tea or in a tincture, something like that. This study that I got a lot of this information from was from like Iran or somewhere. So there's things that we might not use so much, but yep tea is something that's readily available. It's yarrow, elderflower, and peppermint tea. You Google it, you'll be able to find that in your local health food shop. So that's a good, easy one to give your child if they have a fever and they are miserable. Purslane grows, it's a weed. So if you fancy some weed identification, you can go and grab that. Peppermint tea, readily available. Licorice tea, readily available. So, you could definitely experiment with these teas. And then you can use these ones topically. So henna, which I don't know if that would stain your skin or not, but chamomile or peppermint. So you could make a strong cup of peppermint tea or a strong cup of chamomile tea and just like dab it on your child's face. In a foot bath, marshmallow, so not like the white and pink lollies that you get in Coles and Woolies, but the herb marshmallow in a foot bath has some evidence. White willow and sweet violet we'll talk about more in a minute, and then a suppository. So again, suppositories in Australia are obviously not the go, but in France, it's really, really socially acceptable to give suppositories. So that's worth bearing in mind. So this was a fabulous little study, and it was a randomized, triple-blinded, placebo-controlled clinical trial. So that is awesome. That's not one case control trial. That's a good trial. So they took 40 kids with a fever and put them into 2 groups. And they got viola oil, 20 drops of it, and rubbed it around half the children's belly button. And then the other ones, what did they do? I don't know what the placebo was. But in the viola group, there was 30 minutes, there was no significant change in the placebo group. So the temperature reduced significantly in the kids that had the viola oil, and there was no change in the placebo group. And then they obviously gave some kids paracetamol to help them, like in the end. And the ones that needed that in the placebo group was a lot higher. So This oil is not something, again, that's readily available, but you will be able to find it, and you just rub it around the belly button. Like, how cute. And this is another study on some herbs. So Salix alba is the white willow, Glycyrrhiza glabra is licorice, and the viola we just spoke about, and that's fennel, and that's marshmallow. So those herbs as well have, this was in rabbits. But again, there is research to show that that's good for fevers. And then homeopathy. So I'm not, I've done my basic homeopathy training, but I'm certainly not a homeopath. And you will find great homeopaths near you. But also some of these things are just readily available to purchase. So aconite, belladonna, ferrum phosphoricum, chamomile, and then mixtures of these. So again, there's research. There's research for this product called Grip Heal, which contains aconite, Baronia, Eupatorium, Perfolium, lachesis, and phosphorus. And 78% of the cases treated homeopathy were successful compared to 52 for conventional. So homeopathy worked better for this than conventional. I love flower remedies. It's the one kind of really contradictory thing about me, because I'm a mechanical engineer originally. I'm very logic, very science-based, but I love flower remedies because they just work. We don't need to understand why they work. We as humans cannot know these, like we cannot know everything, and nobody is researching flower remedies. But this one, Tall Mulla Mulla, is really good for fevers. So what about a sponge bath? Actually, no. So you can encourage fluid intake and unwrap your child, but sponging doesn't help. And the reason why sponging doesn't help is that your body will always try and achieve homeostasis. It'll always try and get back to kind of an even level of everything. So if you sponge your child, like put like ice packs under their armpits or wet towels all over them, it will cool them down. And then their body will like, I'm too cold. And the body will try and warm up again. So you actually get it's counterproductive, and it will cool them down, make them feel a bit better. But in the long term, after like 20 minutes, half an hour, they will be hotter than when they started it. There is research to say that if you do this with a marshmallow extract, it might be better. And now that I think about it, I think Weleda actually have like a marshmallow body wash. So maybe that would be worth trying. That just came to me there now. But so unfortunately, sponging is not the way to go either. As the fever is rising, keep the child warm or actively warm them. But when they're warm all the way, head to toe, start to peel back the clothes, and then just keep an eye on it. So that's me talking at you, finished. So I would love to know if anybody has any questions. You can unmute yourself, or you can pop them in the chat box. Let me just open, yeah, there's nothing in the chat box. Pop them in the chat box, ask me a question, whatever you like. While I'm waiting for you to think of your questions, this is our details. So because you're here, I'm going to assume that you probably follow me on Instagram. So Pediatric Naturopath. Online booking, you can go to my website, thepediatricnaturopath.com.au. That's my phone number. I'm notoriously bad at listening to messages, so not the ideal way to get in touch with me. But if you're watching this on YouTube when I've uploaded, please like my channel and subscribe and share and all those sorts of things to help me get the message out there. So, would apple cider vinegar or even vinegar sponge bath or bathing be beneficial? No, not really. Not sure what the apple cider vinegar adds, but no, generally sponging with a liquid is not helpful, because you get that reflex where the body tries to compensate for you cooling it down and tries to heat it up. So no. I had a few like projects to do for different courses I'm doing and like study I'm doing. So I end up writing a big essay about this topic as well, which is going to get published in one of our professional journals, which is really exciting. What about potatoes on the feet and the forehead? I have no idea about that one. I did not come across that one. So I used to suffer from really bad chilblains when I was at school because I lived in Ireland. We went to a convent school where girls don't wear trousers, girls wear skirts. So I was frozen my whole life until I went to university and I could wear trousers. So I had really bad chilblains. And it's a traditional Irish remedy that you soak your feet in the water that the potatoes were boiled in. And because we were Irish, we had potatoes every day for dinner. So my mum would boil the potatoes and then take that hot water, put it in a basin with lots and lots of salt, and I put my feet in it. So I'm going to say there probably is something with potatoes that's good for something, but I don't know in this situation, and that is not something I came across. Could we get the slides emailed afterwards? No, sorry, I don't email out the slides. But this will be posted to YouTube, so you can just go back to the start, and I'll be sending the link to that YouTube clip out in an email in the next day or two. But no, sorry, I don't send out the slides. So if the child is not in pain or miserable, you let it run its course and you don't give them anything correct. Keep them hydrated. Is there a point where we should give them something? Not because of their temperature, but if they've got a rash, stiff neck, objections to light, or something else, yes, take them see a doctor, but don't. Yeah, there isn't a point with a fever where you need to give them something. Okay, great. I love questions. My daughter has had a respiratory illness every month for 2 years and has had a seizure each time, over 24 of them. I've tried homeopathics, but we are now on anti-epileptic medication, but no seizure control. So it's affected her development. Okay, so there is somebody on my team called Sonia Reynolds, and she isn't, like, her daughter has epilepsy. She won't mind me saying this because it's in the public domain. Her daughter has had epilepsy since she was like 2 or 3 and was not controlled by medication. Had to, the life-changing thing for them was going on a ketogenic diet. So book an appointment with Sonia, because the anti-epileptic medication is clearly not working. And one of the very basic things, and maybe this has been covered, but is your child celiac? Because that's sometimes how it presents in children, is seizures. So they need to be checked for celiac disease, but I would 100% make an appointment with Sonia, because she has walked this path and she will know exactly what to do and how to get seizure control for your child. So don't delay. Make an appointment with Sonia. My grandmother used to do onion, not potatoes. Not sure if it's different. So again, onions are fantastic. If my kids have a cough, I put a cut up onion beside their bed. People just look at me like I'm a crazy woman when I tell them to do this, and then they do it and they're like, oh, it's incredible. I guess it's the same compound that makes your eyes water, gets into your lungs and releases something. But so again, don't know if there's any, I don't know in regards to fevers, but yeah, you can give it a try. Raw onions in socks overnight, so there's contact with the skin. So you can, I don't know again about the onions in the socks, but you can do something called wet socks, which sounds really terrible as well. But and I'll have to look into the detail of this, but basically you put wet socks on your child, and it's when they're sick, and it's to do with, again, that reflex of you cool down their feet, so your body circulation improves to try and warm up your feet. I can find a handout about that and share it with this, but yes, there is the wet socks going to bed is definitely a good thing for sickness. Yeah, so for Sonia, if you go to my website and go to book now, and just scroll down, you will find the booking link to book with Sonia. But if you also just send me a message on Instagram and I can send you it directly, but it is on my website. Cut up onion, yeah, another thing. Thanks for answering. Yeah. Does anyone have any other questions? And again, you can definitely unmute yourself. Anybody more questions? Otherwise, I will let you get on for the rest of your evening. No problem. You're welcome. I'm drinking my chamomile tea right now. Okay, cool. Well, thank you all for joining me live. I really appreciate getting the questions and having someone to talk to. I had to do a presentation to a room of people last week, and I didn't realize that I would be just looking at the screen, not looking at people. And I found it incredibly difficult to actually talk to a blank screen. So thanks for turning up live. And as I said, I will email the link. I'll have to upload this to YouTube, and then I'll email you the link. So if you want to go back and watch it again, share it with a friend, anything like that, you can do that. So awesome. Thank you very much.